I'm Alice and I'm a child nursing student at King's College London. On my most recent placement I really got to see clinical nurse specialists in their element, and I just wanted to make this video to talk about their role and how I think it's really important that students know that they have access to them and can learn a lot from them. Ever since I started my nursing training as a result of my first placement, I've always had a really keen interest in neurological diseases and disorders. And when I was on my most recent placement at a trust that I would only visit once, I discovered there was an epilepsy nurse specialist. I was very keen straight away to organise a time to shadow him, and I tell you, it was so worth it. Clinical nurse specialists are fabulous because they really have a very self-explanatory job description. They are specialists in those areas and they have so much knowledge to give you and are so passionate in that area that if it's something you're interested in, it's a really great experience to see what the field is truly like. I had the opportunity to go to a doctor's teaching that was being led by this nurse specialist, which was a real privilege because I got to see a lot of the other work that the MDT does as a whole, and it was a really exciting time and a really useful and applicable thing for future practice that I was learning about. I also had the opportunity to sit with him over lunch in his office, and he taught me so much about epileptic and non-epileptic seizures, and he taught me a lot of differential diagnoses that could also be possible with seizures, which was really useful for future practice as well. I think the highlight for me was going to an afternoon clinic that he was running in partnership with one of the doctors. I got to meet some really great patients and their families, and it's really stirred up this passion inside me to pursue neurology as a field in general. What was also really great is that he was very keen for me to keep on learning and recommended that I read this book, which is called Fast Facts Epilepsy, and it's an amazing read. And nurse specialists are really great in terms of knowing what ongoing reading to give you and where else to look for research, and because they're so clued up on their field, they know the newest evidence-based practice and all these things that really apply to what's going on for the future of nursing, as it were, building that future in the field. I understand many students may feel awkward or find it hard to ask other ward staff the opportunity to shadow other staff members, especially as being supernumerary doesn't always seem to translate into real life, and I think that's a struggle a lot of us have, I think. I'm lucky that my ward manager was very supportive of me using the opportunity to learn and taking into account as my only placement at the trust that I would have, just to make the most of it. And I think as long as you explain your passion for this field and go about it in a very mature way, I think the staff will be much more open to letting you go for a short time to spend some time with this nurse specialist. So just a few parting ideas. Don't underestimate clinical nurse specialists. They're really great at what they do, and the passion and the knowledge they have about their fields is so undeniably useful. And if there's someone in your trust or somewhere that you know you're going to work that has a specialist in a specialism that really has captivated you throughout your training, then take the opportunity. I can only recommend it. It just really opens your eyes to other nursing roles and also the role of the MDT as a whole, and it can just really awaken a passion for a sort of the part of nursing that you feel would best fit you, and it's a really exciting opportunity. I hope this video was useful, and I wish you all the best with your training and your careers afterwards. Bye!